Raju, Zubaida ma'am has requested for just 5 minutes. She's joining in. Okay, so other 2 minutes we would request. Good evening, one and all, and we request you to just give us the 5 minutes for our speaker to come and join. She's quickly winding up her practice and coming uh, for the session in this regard. So kindly give us another couple of minutes for her to log in to officially start the program now.
రిత్యా ఇట్లా మాట్లాడతాడా ఏం చూడు ఇక్కడ ఇంకా స్టార్ట్ అవ్వదా వినాలా
Good evening, Dr. Zubeda ma'am. Hope I'm audible. Dr. Zubeda Tumbi. Shall we start the program, ma'am?
Yes, Mr. Ramesh.
Oh, lovely. Thank you. I think nice that I'm able to hear your voice. Yes, everything is on. Thank you. Good evening to you. Good evening to all. And my name is Ramesh. On behalf of Pulse NutriScience, I extend a very warm welcome to this special session, Ramadan fasting and therapeutic diet, supporting safe and sustainable practices. In fact, this is commonly known. Ramadan is the 9th month of Islamic lunar calendar, and it's considered the holiest month for Muslims. And it is a time primarily for fasting. In India, almost close to 12 to 14 hours of fasting a day people observe to maintain a self-discipline as well as to bring in a lot of purification during this particular month. And to talk more about this, the Ramadan fasting and for therapeutic diet, and we have our special guest, Dr. Zubeda Tumbi, with us. And can I have the profile, please, to be put up? Raju? Next slide, yeah. It's a great pleasure and honor for me to introduce Dr. Zubeda Tumbi, Founder Director, Health Watch Nutrition Clinic, Mumbai. And Dr. Zubeda Tumbi is a renowned clinical nutritionist with over 36 years of experience in nutrition counseling, clinical dietetics, and public health nutrition. She's a founder and the director of Health Watch Nutrition Clinic, Mumbai. Her expertise includes weight management, metabolic diseases, therapeutic diets for all age groups, and lifestyle-based health programs. She has also served as a senior college lecturer almost for a decade between 1989 and 1999 and actively contributes to public health campaigns on obesity, diabetes, PCOS, and micronutrient awareness. She has a lot of recognitions, and Dr. Zubeda Tumbi is an acclaimed clinical nutritionist, researcher, and speaker with impactful contributions to public health and clinical nutrition. She has delivered talks at national and international forums, authored textbook chapters, published research papers, and mentored MSc students in clinical nutrition. No doubt, with the 36 years of experience, I think a lot of the nutritionists would have got benefited from her. And her excellence has been recognized with top honors, which include Golden Ape Award, the most iconic dietitian and the nutritionist of Mumbai, that is in the year 2025. IAPE and ICNC awarded her with the first prize for the best oral presentation in the year 2025. IDF World Diabetes Congress, she has won the poster presentation, and she has also won an excellent Lifetime Achievement Award in the year 2024 by R&D Sadhana, and the Best Dietitian and Nutritionist Award in 2020 by Unimo Rangoli Award, and she was ranked one among the top three nutritionists in Mumbai by MumbaiCoworking.com. And thanks a lot, Dr. Zubaida ma'am, sparing your time and being here to share your thoughts on the Ramadan fasting and the therapeutic diet. From here, I request you to please take on and put your presentation. And she will have around 40 minutes of presentation, followed by another 15 minutes of question and answers we will take. Thank you. Over to you, Dr. Zubeda.
Thank you so much, Mr. Ramesh, for this overwhelming introduction. And it's always good to be able to share what we've learned over the years while doing active consultation, because practice makes you more good with what you've learned in theory. And I believe a lot of dietitians whom I see are also well known in their own way. So I'm sure that we can have discussions and interactions once I present my slides. As we all understand, that Ramadan is a time where Muslims all over the world we observe the full month of fasting, and Ramadan fasting is a wonderful way where the Almighty Allah, yeah, He introduced this to the Prophet in his times 1400 years back, that if we can fast for the whole, those 4 weeks, say 28 to 30 days, yeah, it is one of the most important pillars of Islam. And it is a way where the Almighty wanted us to have our body recharged, renewed, and make it in its best possible form. So I understand that safe Ramadan fasting, can be done if you have a good suhoor, a good iftar, because this is a kind of intermittent fasting where we have a dry fasting a technique where, we have two meals. So morning, you kind of before dawn, you eat whatever you can eat with the nutrition understanding as per your body status. And then you have, say, 12 to 13 to 14 to even 18 hours as per the season where you are, the country where you are. Right now in Mumbai, I think we'll have a 13-hour dry fast, because by 6:45, 7, you will have your suhoor, you will have your iftar timing where you'll break the fast. So if we understand the basics of nutrition planning, because I believe that here the audience is all nutritionists, practicing dietitians, and a few doctors who joined us. So if we are able to help our patients, plan their nutrition in the right manner, they can have glycemic stability and metabolic balance with adequate hydration and infrared preservation. So what we need to make the patient understand is that he or she should be educated, they should be aware, they should be able to monitor their own health status, and they should have understanding when they have certain risks with regards to food choices that we make. So, how do we compare the dry fasting of Ramadan with intermittent fasting, which is now very much commonly used by a lot of dietitians and healthcare professionals? So, what we can do is that here in Ramadan there is no water, no fluids in the fasting hours, but in intermittent fasting you allow black coffee, black tea, green tea, all the water-based hydration is allowed. And here you have a flexible eating window. See, you will have say between 8 hours of say eating and 16 hours of fasting and so on. But in Ramadan it will be as per the season, the country where you are. So whether it's winter, summer, likewise you will have your 12 to 18 hours of dry fast. And here the restriction is there is no restriction in eating. You can eat whatever you can get as per season, as per what you can make, what's available to you between iftar and suhoor. So the eating window may be 4 hours or even 8 hours, depending on the season and the country or region that you are, even in India. But in intermittent fasting, you will have your, as per the physician or the dietitian, you will have your eating window. What is the metabolic impact of dry fasting? You will have fat oxidation. There would be mild dehydration. But both these dry fast and intermittent fasting can improve insulin sensitivity and metabolic enhancement. There would be a dehydration risk in hotter climates or whether a long fast, like I believe in Australia and some countries, you will have 16 to 18 hours of fast. So there will be a risk to dehydration. But again, If you are, planning your meals and your fluids, then you will be in a much healthier state. In intermittent fasting, there is minimal dehydration risk. Say, primary purpose for Ramadan dry fasting is a religious, fasting as per Allah's will and Allah's command. So all of us will practice it all over the world, wherever we are. Intermittent fasting is done for health reasons, for weight and for metabolic health. So here you have 1 month of fasting in dry fasting or Ramadan. And in intermittent fasting, you can do it for as long as you want as per supervision and assistance. Medical supervision is required when you are at high risk. I will discuss these things in my subsequent slides. So what I want, all of you all to understand is that when you are fasting, and you are refeeding between the suhoor and the iftar, there's a lot of metabolic changes. And there's a, divine cleanup and regeneration that happens in your body all over. So what happens is that it will boost fat oxidation because, when you've had your suhoor or the meal before dawn, you will have justifiably nourished your body. But after a few hours, once that blood sugar starts, coming down, and there's a drop in the IGF levels, and there's an increase in the ketone levels, and the AMPK levels will rise, there will be a metabolic switch. Because the AMPK, which is the enzyme, it will stimulate energy regeneration. There will be a glucose uptake, and there will be fatty acid oxidation. In the same time, it inhibits, energy consuming processes like lipid and protein synthesis to restore the balance. So you enter a phase of autophagy. There is cellular distress because the body is going to understand now there is no glucose. So it will start using on your fat. And I have seen a wonderful change when the diets are well planned. I have seen a wonderful change in the visceral adiposity index in my old patients. And also a lot of patients who have autoimmune disorders, even cancer patients, they feel renewed because the old cells are, broken off, taken away, and there's an emergence of stem cell activation. There's a metabolic shift alertness. Because at iftar, once again, if your nutrition is done in the right manner, you will restore insulin and growth signals. You will enable protein synthesis. You will have tissue repair and immune regeneration. You will provide refeeding. And the refeeding is done the right manner, not what you normally see in most households. People eat excessively, they drink sugary things, they eat fried foods. Now, that is a cause of concern here. So, as nutritionists, I think we need to educate our patients whenever, however possible, with the right kind of, understanding that you need to eat right because 12 to 14 hours is a very long fast, and the body needs to be nourished slowly, gradually, so that there is a therapeutic Ramadan nutrition happening in this month, whereby you can understand how you can improve your glycemic status, improve your, inflammatory balance, and you will improve a better metabolic health if done correctly. That is a very important understanding that we need to create amongst our own patients and those who follow us on even social media. So, what I have seen and what I have read and what I have practiced and made people do is that when Ramadan fasting happens in the right manner, you are more alert, your moods are more happier, there's more mental acuity, alertness, clarity, there is reduced neuroinflammation, and you are also reducing the risk to Alzheimer's and Parkinson's. This is very well researched, and I have seen in my own patients who come to me, elders who come to me, they ask for permission, they ask me for guiding them, and I feel that the right nutrition can certainly make a very big, important difference in their health. It'll boost energy levels because they're promoting fat utilization. See, most of us, when you're losing weight, we don't lose fat, we only lose water and muscle. But here, if your, suhoor and iftar meals are well planned and you're living in the right way, even the day you are working, active, you will see fat utilization for energy instead of carbs. And that will sustain the energy and keep you steady and calm in the whole day. So if you are obese and looking at weight management, do the right things to achieve the right body weight and reduce the visceral body fat, because you will then increase metabolic efficiency. That's very sure. You will reduce calories, but you will improve your protein and carb and complex carbs and fiber intake, whereby you will see a better sugar control. You will see, activating autophagy, and you will improve your gut health. Because I've seen that gut health, people with IBS, irritable bowel syndrome, with constipation, long-standing, drug-induced constipation, they are the ones who are the best impacted with good nutrition in Ramadan month. So what do I need to make you understand here is that When we are looking at Ramadan fasting, we're looking at physiological and pathophysiological risk. So when you are a healthy person, you will see a wonderful shift from glucose to fat oxidation, you will stabilize energy reduction. But when you are looking at diabetics and those with cardiovascular diseases, what do you see? Impaired metabolic switching, increased glycemic variability. But here again, if the diets are planned and if you are, looking at a person's lab results a month before Ramadan starts, and you teach them how to change their diets, include the right foods, then those are the patients who achieve much stability in the month of Ramadan. That's very much I have seen, lower requirement of drugs, lower, hypoglycemia episodes. Once the patient learns to use the right diet, the diet becomes the right tool here. So glucose homeostasis, maintain fasting sugars with mild fluctuation, because within the first 7 days, the body learns to understand that yes, now there will be no water, no food coming in, and there will be good 10, 12 hours of, you know, uh, fasting between the suhoor and the iftar. So the body will acclimatize. Our body is a wonderful vehicle. It will acclimatize whatever you give. Yeah. Once again, when you're looking at the hormonal response, I know that because we are awake for prayers, sometimes late night, there's a shift in the circadian rhythm and there's an impact on insulin, cortisol, melatonin. But once again, if you are disciplined and if you're eating in the right timings, I would say, I would discuss in my subsequent slides, you will have lesser dysregulation of insulin and lesser stress in your hormone balance. Hydration status, learn to maintain the right kind of fluids. If not water, I will teach you what fluids can be had so that between the iftar and the suhoor, those 8 hours or 10 hours, you will be able to hydrate the body. So there will be lesser risk of dehydration and electrolyte imbalance. Cardiovascular load, I have seen that blood pressures and heart rates are better if good nutrition, some pranayamas, light, asanas, stretches, practice walking with, meditation with tasbih, you can have better blood pressure control and lesser arrhythmia risk. When you have, a good dietitian and a good doctor handling your diet and drug, you will have minimal, chronic requirement of medicines. And for those who are already on medication, they will learn to reduce their risk and pharmacological dependence. Sleep wake cycle, I'm sure if you learn to sleep between 10 and 4, those 6 hours of good sleep can help you with, a good morning ghrelin leptin response along with insulin response, which is your hunger hormones, satiety hormones, and the way you will use your carbohydrates. So clinically overall, if you are good with a good diet, excuse me, you can be a good status. So what do you see in different kinds of, see, because when you are, in a clinic or in a hospital, you will have pregnant ladies, you will have GDMs, you will have type 1, type 2, you'll have elderlies with chronic, 1 plus more diseases, CKD patients, CVD patients, people on dialysis, children, all breastfeeding women, they will all ask for your advice. So if you have studied their diet and if you are with them, a month before Ramadan, then you can tell them that if you're pregnant and if your labs are good, you can, have a good diet pattern and the right nutrition, the right supplements, and minimalist activity. You will, with resting periods, you can monitor your blood glucose and you can stay healthy. And I have seen good pregnancy outcomes, so not to worry. But if you have a GDM, then that lady should be, taught how to monitor her fasting blood sugars below 90, post-prandial, around 120, and if she can have CGM or regular self-monitoring of blood glucose, she can be in a wonderfully maintained glucose and nitrate nutrition status. Type 1 diabetics again will require their doctors. I would not recommend it if the doctor and dietitian have, help them pre-Ramadan, then, they can be doing Ramadan. Otherwise, they can, not be recommended. Type diabetics, with no complications or very less risk, they can, achieve good glycemic control and they can reduce hypoglycemia risk. So they can learn to understand their things. But here again, I would say start at least 4 weeks prior Ramadan startup. Elderlies, again, if they are well controlled with the right kind of medication, they understand what foods will, impact their blood sugars, cholesterol, or BPs, then they can be allowed to fast. For CKD, first, second, third grade, it is still okay, but the ones with fourth and fifth stage are not to be advised with fasting. Those with cardiac diseases, again, I would say, when you personalized diet and, drug maintenance, then you can achieve a better status. But please get these things checked with your doctor and dietitian. So dialysis patient, I would say very high risk, not recommended. For children, adolescents, if they are healthy, if they have got good, diets already in place, then they can be allowed to fast. But again, post-puberty is the right time to start fasting. For breastfeeding women, if they are able to, eat well and hydrate well, they can choose to fast. So once again, I have seen that often it is seen that people say that because, Ramadan, we don't sleep well, so they impact the circadian rhythm. But I feel that when your sleep and your waking patterns are maintained, because all of us who are working and who want to, maintain our sleep-wake cycles in the right possible manner, as I said, if you can finish eating before 9 and prayers by 10, and if you can sleep between 10 to 4, so then when you wake up at 4, 4:30, those 1.5 hours of suhoor, that meal before your dawn, you can actually hydrate well and eat well, whereby you will have better cognition, better, rhythm, and you will sleep well. So I think it's all about, your habits, your discipline on what you eat, how you eat, when you sleep, and how much you sleep. Now, looking at, certain habits, or I would say, when patients come to me, they say that because I'm fasting, I'm going to eat all the fried delicacies and all the sweet things. I would say, please let this month be a month where Allah Ta'ala wanted you to fast in the right manner so that you have a better body status. You will be a better version of yourself mentally, physically, physiologically, and health wise. So don't skip suhoor and don't have sugary drinks. I would teach you what to eat right and how to eat right. So first things first, I think water or hydration is very important because most people I find they don't even have 2 to 3 glasses of water, which is a big mistake. Because if you're going to, mistake your uh, thirst for hunger and just keep on eating, I think that's a big mistake. So between at the iftar timing, you can have, around 2 to 4 glasses of water. If not just plain water, you can have lime water, you can have date and lime, you can have pomegranate, watermelon, you can have a lot of oranges, muskmelon, as these can be eaten and these can also be made into a drink because these can be, no, don't add sugar. You can have them because the fruits already have got fructose and they have got fiber. So between the fructose, the fiber, the glucose, yeah, of whatever food that you may be eat, maybe you can have a milk fruit shake. Maybe you can add a protein supplement to your milk with chia seeds. So these can add to your hydration status. So these are some tips which you can give to your own patients. And do not drink too much of water at one go when you hear the azan for iftar. Go slow, have 1 or 2 or 3 dates. You would select between your dates like your ajwa, sukri, and you have got kalmi. These are good dates with lower GI. One thing you take care of is you should limit caffeine and sugary drinks and salty foods and avoid spicy fried foods as they will increase your thirst. When you are well hydrated, you will have lesser dizziness, headaches, and fatigue in the daytime. You can also look at coconut water because in the south and wherever it's available easily, even in Mumbai, I think you can have that as a drink as well. So dehydration in Ramadan can actually, force your kidneys to go into some trouble like kidney stones, or you will have some kind of issues with the salt and water conservation. So if you are well hydrated, you will be good. But if you notice that your urine color is darker and the quantity is lesser, you should help the patients to improve on their hydration with tips like chia water, zira water, fruit, juices, not with sugar. They can be allowed to have soups. So then, they can have a good electrolyte balance. When you're looking at proteins, I feel that when you are looking at your suhoor, I always say that protein is one thing I find missing. I find often patients telling me that we just have biscuits, rusks, a sandwich with a cup of tea and coffee, and that's suhoor. Some just skip food, they just have a cup of tea. Some will just have a glass of milk. I would say that is the biggest mistake because proteins at suhoor will give you stability, satiety. You will have a better blood sugar control and you will have a better muscle mass because I repeatedly have spoken about fat oxidation and you're going to reduce your visceral fat. So if your muscle mass has to be maintained, which will help your bone mass by staying active, your proteins are the key. So you need to have good protein sources like you can have your lean meats, right from fish to chicken to mutton to your say prawns to your organ meats, everything can be eaten. Dairy products like milk, curds, paneer, cheese, milk powder, Greek yogurt, and legumes. You can have all your dals as a chila, as a you can
Ma'am,
make
we
a
can't hear your
cutlet.
voice actually. It's very soft.
None of you. Oh, why is that?
We can hear. We can hear you.
No, we are able to hear clearly, ma'am. Absolutely no problem. I think
Because
maybe
I
you will
have
have to check your connection. I think so. I am able to hear
that's
clearly.
that's the
I am
viewer, right? The audience, na?
Yeah, we all
It,
can hear you. I think only one person is not able to hear you.
Fine. So I
okay.
think I'll continue. So with legumes now, I really want to make a point here that a lot of us only have polished dals. And here, if we can bring back, the use of brown chana, Indian black chana, brown chana, soaked, if possible, sprout. You can have your chickpeas, which is your chole. Then you have mung, you have got matki. One thing, one pulse, which most, are not eating regularly is the horse gram or kulit. I think kulit is a wonderful pulse, whole grain, which you can soak and use because that helps to reduce uric acid. It helps to clear the urine. It is a wonderful diuretic pulse. So I think people with issues with urine or blood pressure or kidney stones or uricemia should use kulit more often. And I have in my YouTube some recipes where I've shown how to make kulit, cutlets and kulit chaat. So I think chaat where you can just soak and discard the water, so you reduce the gas producing capacity of the pulse. And you can boil with ginger, black pepper, with a bit of vinegar. And that can be, topped with curd. You can have your date tamarind chutney. You can have chaat masala. You can have a pudina chutney. These are wonderful ways to improve the micronutrient and the fiber content of your dish. So your chana chaat, your moong chaat becomes a complete meal. And that can be a wonderful adjunct to your iftar, times. Tofu or soya paneer, again, a wonderful plant-based protein which you can toss into your vegetables to make into a tikka, to make into a cutlet. Please stop deep frying. Make it like a sauteed thing or on the non-stick pan. Eggs, I feel are the best foods because they're complete foods. They only lack fiber and vitamin C, which in my recipes on the YouTube, I've shown how to make 10 different ways of eggs. You can have your egg stuffed, egg layered omelette. You can have a salad. You can have a burji, where I've shown how to use coriander, mint, parsley, spring onion leaves, tomatoes. So you can look up those recipes to help your own patients. Yeah. So right way, to achieve the balance of the carbs and proteins and micronutrients at iftar. We will talk about iftar. We'll also talk about suhoor. Iftar is the meal which Muslims will eat when they hear the azan at Maghrib. That is, at sunset. So iftar, should be well planned because after 12 to 16 or 18 hours of fasting, your body is completely clean. So you need to be gentle, need to open the fast with the date as the Quran and the Prophet has suggested that breaking the fast with the date is the best way because dates are loaded with natural sugars, fiber, and then you can have a glass of water, you can have chia water, you can have nariyal pani, you can have a soup, I would say a clear soup, you can keep it at room temperature because nowadays it's picking up in temperature, right? So that will give you your, electrolyte balance. Then I would say you can bring in a salty item, so you can bring up your chaat, you can have your dahi with your chutney on your boiled pulses. You can have dahi bada light, that recipe also on my YouTube. You can have your dal ka chila or dosa, which is adai dosa, or your pesarattu in the south. That can be had with a filling of chutney, salads. and a dip made with, the dahi and coriander mint. Then you can take a break for namaz. See, we have a namaz, Maghrib namaz, which is again 14 Surya Namaskar. So if you take a break for that 14, sajdas of Maghrib namaz, you get a 10-minute break. Then you can come back and have a complete meal, whereby you can bring in your non-veg, you can bring in your roti, bread, rice, khichdi. All those things will help you with good nourishment, because after that, you will have a 1 to 2 hours of long namaz, which is called as your Taraweeh. So that is again, 40 to 50 namaskars. So those who don't understand namaz, we bow down on the ground. So we stand, bend, we go down, we touch the forehead to the floor. So that's like a namaskar. So there are 40 to 50 namaskars to be achieved in 1 to 2 hours of proper namaz. So if you are going to have a well-balanced plate, even, post that short break at iftar, that good meal of roti or khichdi or dalia with proteins. Yeah, you can have chicken, you can have your fish, mutton, keema, whatever you like. So here I've tried to show you how you can break up the suhoor, the iftar, which can be a snack, then the post-iftar meal. And there are some people who also want a little snack, at 10. They feel tired. So I tell them, okay, have milk with some natska powder or like a makhana powder, or bring in a protein supplement, or bring in, your fruit with flax seeds, like a milkshake. See, proteins I spoke about, your fish, anda, your chicken, egg, chicken, fish, mutton, keema, tofu, dals, sprouts, your lipids. You can restrict your oils like sunflower and palm oils, because those are highly inflammatory. Bring in our Indian sesame oil, mustard oil, groundnut oil, even coconut oil, if possible, olive oil. And I would say bring in seeds. You can roast the seeds slightly. So the saponins and those seed anti-nutritional, factors are like peanuts, never have them raw. So lightly roast. So if you can just bring in a spoon of peanuts like a laddu, or you add it to your chutney or dips, or you can also make a date and sesame laddu. That recipe also there on my YouTube. You can check it out. So those can be subtle ways of adding to good nutrition with good calories, because you need calories with higher fiber, sustain energy release, not something like sugar and those carb drinks which you get in the market, those carbonated beverages. You look at all things natural. Nothing should come packaged in this month. Then, when you bring in the vegetables, because I often find that people cheat in Ramadan. They say, now I won't have any vegetables. And they are the biggest, notorious people. So, how do I teach them? I tell them, okay, make a chutney, add it to your bread with your cheese and egg. That becomes a complete meal. You can have the chutney with some veggie into your uttapa or dosa, or add vegetables with the mutton chicken into your pulao. So you have a mutton vegetable pulao, or an egg chicken fried rice with vegetables in it. Then you also have an accompaniment of a veggie stew. Like you can have a pulao with a mutton and dudi stew. You can give them such ideas. So I think these are wonderful ways of bettering a person's plate with good ideas, as we all dietitians are always doing. I'm just trying to build on some ideas, because I believe that dietitians all over India, all over the world, can learn from one another and improve on our patients' health and nutritional status. So I believe that in Ramadan, for people who are diabetics, GDMs, or those who are at some kind of fears and risks, what they can do is they can monitor their blood sugars. Now, once again, there's one big fallacy amongst most Muslims. They say, I will not do blood testing. I'll break my fast. I always say, to give blood for blood testing, you don't break your fast. You can also inject insulin. You don't take blood transfusions. That's not allowed. Corrected? So you can tell your patients with a confidence that yes, you can do your blood test. If I encourage people to do the fasting blood test at between 5 and 7, the time nearer to iftar. Okay, so pre-dawn, so those who are worried about their blood sugars and variability and they are scared of hypoglycemia, they should do the pre-suhoor, pre-dawn meal. They should take their sugars, like how we advise fasting blood sugar, then morning, then mid-morning, mid-afternoon, then before iftar, like how we do as a fasting types, and 2 hours post your iftar. That is the proper meal that you have after your Maghrib prayers. After 2 hours of that meal, you should test your blood sugar, see how good or how well maintained you are. I hope that helps. Yeah. So people, how do you tell the person to be very, alert? How do they know that they are going in for hypoglycemia when they start sweating, shaking? They have a fast pulse rate, they have irritability, anxiety, they have dizziness, tingling of lips, they are fatigued. Okay, hyperglycemia again, extreme tiredness, increased thirst, headaches, blurred vision, fruit scented breath. This is a very common symptom I've got. And going to the loo, very often. Now, when you have diabetic ketoacidosis, so these are symptoms like excessive thirst, mouth dryness, and fruit scented breath. Then you have increased thirst for dehydration, not going to the toilet often, dry lips and skin, and the urine is too yellow or too brownish in color. That's when you are not looking at hydration status. Okay, so understand the risk category. Category one, which they should not be, given the permission to fast if they come asking you. People with severe repeated low blood sugars, okay, diabetic ketoacidosis patients, kidney problems, CKD 4 and 5, then people with type 1 diabetics, acute illness, pregnancy, heart problems, old age with ill health, people with a lot of comorbidities, they shouldn't be allowed. Like I had a lady who came in day before, she is in a case of CKD and grade 4. And now she is controlling her sugars and she told me, I'm going to fast. I said, no, madam, you can't fast because you will risk your health. Can you mute the people, please? Yeah. So category 2, you will who should again who are high risk. So people with badly controlled type of diabetes, TK pregnancy again with some problems, kidney problems, or people who are in heat and working on the field, laborers. They should be very they should be given some caution. And people with low risk are the ones with controlled diabetes, on good lifestyle with good dietitians and doctors, and they know their medicines and the impact of food and medicines on their blood sugars, they can be allowed to fast. Yeah. So people often feel that, Ramadan can be generalized. I feel that if you have a target, see those who come for better glycemic control, diabetics, or people who want to lose weight, or people who want to be more, healthier, people or to like I have a woman who's coming to me for rheumatoid arthritis. So I've given her a good diet and she looks, and we've done some practice sessions with her in the last, because before Ramadan, you have the month of Shaban. So there, I told, okay, you can do one fast a week. And then we saw how was the status. And she was so much happier. So she can now fast from tomorrow as Ramadan starts tomorrow, inshallah. So she will be in a very, very, because she has been given a personalized diet for metabolic, repair, gut health. So you should give them, what can be sustained and ensure that the nutrition is taken care of. Okay, so there should be no fatigue and no hypoglycemic statuses. We should help the patient understand the drugs and the foods to be eaten in the right manner. Okay, now exercising in Ramadan. This is one big question amongst the youngsters or those who are into daily exercising. I would say it is safe. So before iftar, I also practice this before iftar between 5:30 and 6:30. I would just do walking, but I do walking, and I practice my chanting, which is tasbih. So that is meditation. So that is walking slow, and you can do that. You can do slow stretches. Yeah, because you know that you're in the house, people are monitoring you, and you'll be in a good status. People with, after iftar, they can also do a quick half an hour of cycling, skipping, or whatever they are used to, stair climbing. People can also do it, post before suhoor, because you've eaten at iftar, so you have got some nutrition. So if you are waking up early, you can also do your gym fasting at that time, or late night after your eating and Taraweeh prayers. People eat before Taraweeh, then they go to the gym. That too is permissible. But you should know how to stay well hydrated with good nutrition. Okay. So after Ramadan again, that is again a very big, window where people fall sick because they feel that now that Ramadan is over, I can just start eating, gorging, and eating whatever comes my way with heavy biryani and fried puris and your shir khurma. I would say introduce the foods slowly. You may have people coming over, but don't go overboard. You have your own. Once again, you start your day with khajur, with a fruit. You have your egg with some veggies. Have one roti or some poha with sprouts and nuts in it. Always ask the person, whichever region they are, If they're doing an upma again, they can make with millets. They can have dalia. They can introduce your low GI rice ka rava with sprouts, nuts, seeds, certain vegetables like peas, tomatoes, carrots, bring in some curds, chutney. That way, that recipe becomes a properly managed, high protein, high fiber, sustainable, impact meal. So once again, I say, we don't need to rush into proper three large meals. You have, your 2 to 3 to 4 smaller meals. So go slow. Stay well hydrated. Be mindful. Eat, chew the foods. Feed, you should be able to understand your fullness cues. Okay. But once again, I would say please bring in vegetables in the salad form, chutney form, add it to your chapati, add it to your rice, but please bring it in. You are not exempted from sabzis, and especially in the month of Ramadan, right? So stay active, continue with your yoga, your walking, your gym sessions, sleep on time, wake up on time. So I would say Ramadan, which is the time restricted metabolic adaptation, helps to shift from glucose to fat utilization. When you are guided medically and nutritionally, it will enhance metabolic flexibility and insulin sensitivity. So you will have enhanced cardio metabolic benefits. I have seen them in all kinds of patients, whether you're not diabetic, type 2, GDMs, your blood pressure patients, people who are weak, people who are having IBS, autoimmune, all the patients, if they're guided well, they can, fast in a healthy manner with great results. Do it safely with risk stratification. Those who are, if you can identify your high risk patients, give them proper individualized, personalized training, and monitor them, keep calling them, checking on their blood sugar levels as we do in our clinic. So I have introduced the IDF diabetes in Ramadan, guidelines in my talk today. You can look up the paper. So safe fasting is not abstinence, friends. It is science. It's a structure, individualized care. And I hope that this Ramadan be the best Ramadan we've all had. I'm open to questions. Mr. Ramesh, if there are any, people can ask for themselves.
Thank you. Thank you for this wonderful presentation, ma'am. I picked up a lot of points definitely from here. There are a few questions which has come up, but before that, just some of the points which you have highlighted, definitely I would just give them. You have talked about how to manage and be adequately hydrated. That is one of the important point which you have really highlighted, and restrict spicy food and sugary drinks. That is another point which nicely came up. Lose fat, but not muscles. In this connection, there is one question which came. Planning to go to gym. Suggested timing and type of workouts what I can have.
Well, I did cover, but I'll repeat it once again. See, if you are a regular gym person, and if your timings were, say, early morning, then you have to shift it to, post your iftar, where the meal and the hydration is well looked after. And you can carry your protein drink with some chia seeds, okay, to the gym, and you can drink it at halftime or, post your gym, and carry the water. Carry your bottle of water with lime, electrolytes. You can have coconut water. You can have your cooled soups. I advise patients to, have a broth of vegetables. You can take it like a clear soup into your sipping bottle, then you can have your gyms. There's no problem. And then you can come back and you can have your, probably if you can have a small meal. Say if I divide the plate into 4 parts, you can have like 4 to 5 spoons of your low GI rice, or say, you can have a roti from any of your, unprocessed wheat, barley, or any of your millets. You can have salad. Do not forget the raw vegetable salads. You can bring in some chutney, bring in, a glass of buttermilk, or you can have your vegetable dahi raita, and you're good to go.
Thank you, ma'am. And another important point which you emphasized was good and adequate diet planning for iftar. A connected question to that: what should be our plate look like at iftar for fat loss?
Okay, so you start with a date, yeah, then you can have a glass of, say, water with lime and some chia seeds. That's very good. I would say please avoid all simple sugars, table sugars, Do not even take jaggery and honey, it's not needed, because then you can have, your 200 grams of fruits, which, you can bring in some watermelon or muskmelon or pineapple or oranges, whatever the season, whatever is available in your area locally. I don't advise, you buying blueberries and blackberries. Just look at regional fruits. You can have either an apple or a pear along with that fruit, and then you can have a good protein. So you can, if you're looking at fat loss, weight loss, and visceral adiposity, decrease, you can look at boiled sprouts or boiled legumes. Like I mentioned, your chana, chole, rajma, moong, matki, or you can have a tikka, marinated your chicken or mutton or fish with vegetables. The vegetables are important in the raw form. That you can bring it in. You can bring it like a, chutney dip, or, you can have a vegetable smoothie as well. That can, along with your proteins and the fruit and the kaju, but eat slowly and stay hydrated. That can be the best way. In hydration, I would say, manage this, the rule of, 4-4-4. What is the meaning of 4-4-4? I would say, say 3 to 4 glasses at iftar, but then, not just water. You can have water, lime water, coconut water, buttermilk, vegetable soups. You can even have a, non-veg stock-based soup, not hot, but well, however, avoid tea and coffee, because tea and coffee can be, it can dehydrate you and you will have lots, of urination that you see in post-coffee intake. If you have to have a coffee and tea, wait for an hour after your iftar and your Maghrib prayers. Wait for an hour, have water. Keep having water. Go slow. I would always say take a glass of water, settle down, and finish a glass of water in 3 sips. Don't do gut, like how animals do. Sit and have your water peacefully.
Thank you, ma'am. And one more myth you cleared during your presentation is blood test is allowed, but not blood transfusion. You talked about it. There is a connected question to that. They were asking that I'm planning to go to. Can you repeat? Well, just a minute. Can you repeat on when all the check blood sugar levels during Ramadan? Again, they wanted some more reassurance or
Okay,
reinforcement.
let me make it easy. See, we always prescribe to all our patients fasting. Okay, so fasting would be in the evening, because Ramadan, you have nocturnal eating. You start eating after 6:37, 8, wherever, in whichever country, your Maghrib prayers happen, right? Okay, so you will advise that fasting to be at 12 hours. Supposing you finished your suhoor, the meal before dawn, say at 5, then you can do at 5 in the evening. Get that point? That is most important. Then you have the 2 hour post meal. That would be the meal you will have. See, in some families, they will have a proper meal after the Maghrib prayers, and then they go for the long prayers. You have a long prayer and a short prayer. So they will finish that complete meal wherein you will have your chapati or your pulao with non-veg or dal with your sabzi, salad, dahi. After you finish that meal, now wait for 2 hours and then you do it. And for other blood testing, for people who are diabetics and those who want to be very good with GDMs and all, I would say you can see the blood sugars, 3 hours after your morning suhoor. Supposing your suhoor happened at 5, you can monitor at 8 o'clock, then 12 o'clock, then at 3 o'clock, and then, just before iftar. Is that clear now?
Hopefully, I'm
Yeah.
sure that it should be very clear by now for them in this regard. There is another connected question they've asked.
Yeah. Yeah.
Maybe I don't know whether it is related to Ramadan and its fasting. How can I increase my muscle mass lost due to diabetes?
Oh, this is a very wow question. But you know what? For such patients, they should be told that you need to be with your dietitian, for longer periods.
Yeah.
There are patients who come to me 3 months prior Ramadan, and they have improved on their nutrition, combinations, what goes on their plate, the number of meals, what to eat, when to eat, how much to eat. And then we suggest that, okay, if you can have your veg proteins, non-veg proteins, and if you can't eat too much, then you have a supplement, no protein supplement. Like, you can always give your 5 grams of a protein which comes in a sachet form, like Pulse has a good protein, which has got no flavor. That's a wonderful way to, add to your buttermilk or into your dal or into your chutney or stuff it into your paratha. So that's a good 5 grams of first class complete protein. Or those who like to have those other supplemental proteins, they can bring in 30 grams. They can bring that protein a little after the iftar is done. No, post Maghrib prayers, they can have a glass of protein shake.
Okay.
But for that, I would say do not bring in sugars, because sugars will simply, not make you let you eat enough other foods. Your calories will come from sugar. See, if I say 1 tablespoon of sugar goes into making some kind of pudding. Yeah. So if I have that is 15 into 4, 60 calories. But in place of that, if I bring in, say, a bowl of, chana chaat or an egg or a cheese cube, 6 grams of protein, same amount of calories. That would be a better way to have sustainable blood glucose levels. And gradually, as your proteins are better, as you exercise, as you sleep at the right time, you should sleep by 10:30, if possible, 11 max to max. Get that body rest between 10 to 4. That's 6 hours. Can be the best way to have your day's activity. Then you can have an hour's rest between your suhoor, that is your pre-dawn meal. You finish by 6 and you finish some prayers, okay. Then you rest between 6 to 7, 1 hour break you take, and then you go back to work. You will be rejuvenated. You can have one more, short sleep nap, a quick, powerful nap, 10 minutes, 30 minutes, at around 2 o'clock. That's when you feel a little tired. And then again, you will feel energized. I have been practicing it and I've been giving this guidance to all my patients for the last so many years. It works.
And you have been requesting or asking people to minimize sugar, but can I use stevia instead of sugar?
See, I'm one person who is not happy with either sugars or sweeteners, because sweetener, this is my personal view, and that's how I help a lot of patients. When you use the sweeteners, what are you doing? You're tricking your body with a sweet taste. So what happens? Your threshold for sugar goes much higher. Yeah, so then you will want to have sweet things. Now, when I stopped having sugar in my tea or whatever, 33 years back, I was a case of GDM. My son is 33 now. So that time when I realized that, my sugars were around 5.9, I realized that, something has gone wrong in my feeding or my, pampering by my families, both families. Yeah, because I had a big baby at birth. So that is a sign of, again, diabetes. So I became very careful and I began just not looking at sugars. Sometime when there's a festival, I would have a half a bowl of properly made kheer. No sweetness, no sweetness. A properly made shirkhuma, kheer, halwa with little lesser sugar. You introduce raisins, dates, your dried dates, no kharakka powder. That powder also can be used to sweeten your halwas and your farni and your rice kheer and your rava kheer. It works. You can check out my barley kheer recipe on my YouTube. I've shown that with great
Yeah,
variety.
very
Check it
important to
out,
people to
friends.
watch the YouTube channels. Primarily, there a lot of information in this regard is being
I have
posted.
I have
We'll
made
take
it
one last
with
question.
specific. Here the understanding is that people, who are wanting to improve nutrition, and dietitians who want to, give the right advice, can look at those recipes with a simple recipes with nutrition message there.
Excellent. Definitely, I would recommend that people should watch that in this regard. And ma'am, one last question we will take before we wind up. Very important aspect people have asked for: how to manage acidity and gastritis while fasting.
Wonderful question. I think I forgot this, so thanks for reminding me. I would say those who have acidity, they should avoid the frieds and those spicy, those sauces which are available. Especially Ramadan time, people have lots of spicy sauces and spicy, fillings in their non-veg fillings. So you enjoy your non-veg, but don't put much spice. And you can make a chutney or a dip with curds and coriander and mint and ginger. That really helps. Reduce the
Yeah.
garlic and the garam masala. And there's one more tip. You can just advise the patients to chew on raw cumin, which is zira, along with fennel. Fennel is soft. 2, 3 black raisins, 1 black pepper, You chew it very well. You can do it at the start of your meal in the morning. And just when you start your iftar, you have your date, you have your fruit, and you can have this mix. I repeat, of cumin, fennel, 1 black pepper, 3 to 4 black raisins, and you're good to go. Avoid fries and avoid sweets.
Fries and sweets need to be avoided. Excellent. Thank
Reduce,
you. We have
refrain.
furthermore a lot of questions due to the constraint of time. Primarily, what I thought was we will send you all those questions. Maybe we'll answer. We'll go back to them with your answers in this particular regard at a later time. And I think so. Thank you very much. I should thank you wholeheartedly for the wonderful effort you have taken with so many challenges in this particular regard to put up this presentation and give a lot of information that what people should do and how they can effectively come over primarily for all these 30 days and have a healthy Ramadan fasting primarily during this time. Thank you. Thank you very much and have a wonderful evening, ma'am, in this regard. Thanks a lot for all the audience also for the patient hearing. And I also would like to thank my team who have really worked behind and reached this particular message of Ramadan fasting to as many people as possible across India. And thank you for all the Pulsarians also in this regard. Thank you and good night, ma'am. Good night to you in this regard.
My pleasure. Thank you so much for the invitation.
Bye. Thank you.
Yeah.